appreciate the altoids, Jimmy.
I know, and I share them. And remember
Yes.
something, Miss Manners says to never turn down an offer of a breath mint.
You are good to go now. Have a
Thank
good
you.
meeting.
Thanks,
I'll
Melissa.
turn off my
Melissa.
camera and stay on the back. Thank you.
Thank you,
Yes.
Melissa.
So for any of the public that may be watching, we did have some technical difficulties for about 8 minutes. And we will return back to questioning with David Juni, Social Services. So Commissioner Davis, you were through, correct? Okay. I'm now confused, so I'm going to just go to Commissioner Borelli. Did you speak yet?
No, sir.
Okay. Well, I'm
Uh,
not calling on you now anyway, though. No, okay.
okay. So thank you, David and staff. I agree. It's a great document. Somebody who have to review and submit grants. It is a big document, and it is a lot and I especially think of some of our really small nonprofit organizations to be able to take all this in and turn it around. But all the information is there, and it is once you get through it all, it is everything that we need to be there. So I get that part of it. I'm glad you brought up the 2019 community survey. I know that will come up a couple times through this process, and I think it's a great tool and document as a reminder for all of us, even when we've recently heard, specifically about the needs of the community. For this purpose and the document itself, really my big concern is the budget. I think we're going to need more money. And I know times we've had to go and ask the city council for more money, and I hope that we might be able to do that again. But considering the needs, considering our meeting 2 weeks ago, considering the addition of, let's just take some of the things that you pointed out, David, as you walked us through this document. We're adding the crisis counseling component. And by the way, my friends who was a victim of rape and did get counseling from Maple Crisis Center 10, 12 years ago, they were spectacular. They've always done great work on that side of things. I'm kind of glad that they're coming under our fold as well. But considering the adding on the crisis counseling, considering even, and I kept sort of replaying our session from 2 weeks ago with the needs, especially of community members of color, more often than not, those who work here but do not live here. And I think even if we just took one part and added the food component alone and really focused on our efforts on saying, this very simple opportunity is available, we're going to need more money to provide that to our food partners. And then the staff and the public relations component, the things I brought this up last time, the things that we're asking them to do, especially with the smaller nonprofits who are already pretty tapped out. I'm really concerned about their, being a little overwhelmed about the new things that we're looking for. Hopefully, what I'm hoping for is it puts a little onus on you guys, the staff, that you're going to get more calls about these new components in particular. So the document itself, go for it. Let's get it approved by council as far as I'm concerned. I just think we should continue to have the budget about the conversation about how this impacts our budget. Thanks.
Thank you, Commissioner Borelli. Commissioner Byers, any questions or comments?
Thank you. First, I also found the RFP document to be just easily navigable, and I appreciated that all the documents were there a lot. The one thing I sort of wished I had right at my fingertips, and perhaps this is not a useful request, was each of the service providers that have the budget attached. I wish there was a either a contact or a website sort of quickly there, so I could quickly navigate and explore the right way to go for each of those service providers. That would I think would be beneficial to add into this document, just to provide that level of assistance to people. I'm with Commissioner Borelli. I'm immediately looking at these numbers and also just remembering how much rental assistance was provided in this last year. That was a difference maker for folks, and would really love to know that we are able to sustain that type of support for people into the future, and that it wouldn't take a pandemic to recognize that keeping people in their homes is what keeps them off the streets. And it's just a clear way for us to be able to really dig into that challenge. So those two things are top of mind. And I do wonder just if staff would be able to speak to what support looks like for service providers who are navigating this document. How much, what type of availability social service division provides to people who are navigating this document and may have challenges.
So if I could ask for clarification, Commissioner Byers, when you, your first point, stepping back, about having a link to the organizations. And give me, I guess, because this is the proposal, this is for potential applicants, you would like to have that link so they are able to reach out to those organizations, or?
So they can do more research about what those programs look like, so they can sort of understand where they are different than what has happened in the past, or just provide a little bit more information. I just found myself, as I was navigating this and doing the research over the weekend, looking more into Men's Health Foundation, looking more into Planned Parenthood, the organizations, and just having a URL provided on the multi-pages of that report might be useful to people.
Great, thank you. So the plan is, if commission recommends to council, this will go to council on May 2nd. We've already started to have meetings with individual council offices, reviewing the document with them. It'll be on the agenda of the council subcommittee on homelessness this Thursday. So we wanted, everybody's eyes on it, basically, as many folks as possible. So, but then it will be on the agenda for May 2nd at council. With that said, if everything goes as planned, it's released on May 4th. As I mentioned, it'll be posted to the city's website. We will push it out to all the currently contracted agencies and the list of interested folks. We are available for questions. Our contact information is in the document. We document the questions that are received. So we document the questions and the responses, because it needs to be a level playing field, and any information that we give to a potential applicant, we need to share with everyone else. We will have a bidders conference exactly a week later on May 11th at 10 a.m., which you are all invited to. That's on your, you have that draft, not draft, you have that list of meetings and related activities that's on there. Location TBD, which we will get folks, because at the time, everything was going to be virtual. So we are getting locations, for all of those meetings. So anyway, so that is, we require potential applicants to attend that. And that's really to answer, as many questions as possible. We'll walk through the document with the applicants. We will continue, we will set a deadline for questions. We just need, we need to manage it. But as I said, we document the questions, we document the responses, and we will have those posted and available for all applicants.
Thank you. I think that's all the questions I have, Chair.
Thank you, Commissioner Byers. Commissioner Darvish, did you have a question or a comment?
Yeah, nothing more than what was already shared. The only comment that I need to add is the RFP process. How do we get the word out? I'm sure that's on our website, the city's website, and do we mail out requests, or how do we? So that's one question. And then the second question, great job with sort of the guidelines for what that vendor should be, nonprofit or 501c. 501c3 or whatever category, and I guess they would disclose if they have any relationship with council members or anybody else at City Hall. And I imagine those would be reviewed by the staff and validated, which is great. I think I saw that in here. So one thing was just how do we get the word out, and how do we stay transparent and accountable to everyone in the city as we select those vendors as they apply.
Thank you for the question. So as I mentioned to Commissioner Byers, if all goes as planned, if we get your recommendation this evening for council and council approves on the 2nd, then we will post the RFP to the city's website. There is a page on the city's website. If you go on and just in the search bar, put RFP, you're going to see numerous, RFPs that are currently active at the city. We will post this on that page to the website. We will send it out to all of the currently contracted agencies. We'll send it out to all the agencies that have expressed interest, or frankly, agencies that we think maybe should be interested. So we get it out as much as possible. Here's not a caveat, but I do want to mention with the social services RFP, with other RFPs and RFQs, we have the option of posting it to Planet Bids. The city uses Planet Bids. We use that actually for the consultant for the needs assessment for community members of color. This is a very specific call for proposals, and we're looking for organizations that know the city, that understand the city, understand the uniqueness of the demographics. They hopefully have a knowledge of some of our partners. So we do not plan on putting it at Planet Bids. It literally, as the name implies, that expands it exponentially. And, folks will apply that have no understanding of the community. So I did want to put that out there, because in addition to that, which is correct, any proposal that we receive, any proposal from anyone, anywhere, we will consider it. So we don't get to say, oh, they saw this and they're in, I don't know, New York or wherever, but they, think they can serve this community.
Right.
We have to, take every proposal seriously and review it. So
Right.
That's our process, to go on the city's website and to send it out, as I mentioned. So with that said, Commissioner Darvas, we will make all of the proposals available to this body, to the commission. We'll make all the proposals available to the city council. We look to the commission to do your best to read through the proposals. We understand that sometimes we usually get an average of probably between 45 and 50 separate proposals. We look to the commission to do your best to review them. We look to you. You will have opportunities, as you know, to ask questions as well of the applicants. And then the process is, once we get the proposals and we have finished the review time, staff will bring recommendations for contracts to this commission on July 19th. And then we will come back the next week for input from the commission on finalizing those recommendations to take to council on September 19th. So that the process is in place. It's very transparent. As I mentioned previously with Commissioner Byers, we make all questions and responses public. And that will include all the questions and the responses that you get to your questions. So it is a transparent process. It's a lengthy process, and it's a big endeavor. And especially for folks who haven't been through it before.
Yeah, so I have one more question, if you don't mind. Do we expect the applicants to have sort of a policy on diversity or inclusion, or present how their labor force looks like, or do we have any requirement for them before and after?
So you'll see in this RFP document that we list the recommendations that came from the needs assessment of community members of color, which addresses, some of it addresses workforce, others address, setting goals for, numbers of community members that contracted programs will reach. There's recommendations for how we evaluate that. So yes, we put that in the document, and you'll see a link to the full report as well in that section.
Thank you.
Thank you.
Thank you, Commissioner Darvish. Vice Chair Meltzer, any questions or comments?
Just two. First, thank you, David and staff. This is really a fabulous document. I mean, it was a pleasure reading it, and it was great. But I have one thought, and I hope, well, I don't want to make any more work for you, but in the Aging in Place, Aging in Community initiative, it says, as community members grow older, they can become increasingly isolated, leading to depression and other health and mental health conditions. I would like to suggest that we move that from that initiative and make social isolation and loneliness another city special priority. First of all, social isolation and loneliness is a public health epidemic. Both Japan and England have ministers of loneliness, and loneliness and isolation, while often mentioned at the same time, are very different, and it impacts every generation. And so it really shouldn't be limited to older adults. When compared to baby boomers and beyond, Generation Z and millennials are the loneliest generations today in the world. I think we need to do something with that, maybe move it into its own spot or take it out of Aging in Place, Aging in Community.
So, and I don't mean to, did you have other comments you wanted to make?
No, is there a way we can separate that out and make it a priority in and of its own?
So it sounds as though you would like to amend the recommendation
Yes.
for approval of the document to include social isolation and loneliness as a city funding priority.
Yes.
And we will add it to, and
Yes.
if it's the, so
It
if you,
impacts everybody of every age.
so when we get to the point, when the commission gets to the point to make that motion and second it, you will want to have that revision included.
If
So,
possible.
yeah, so noted, thank you.
Can I make
Okay,
one-
and
Can I make one suggestion, Barbara? Can you have it written out completely so we understand it when we get to that point, that exactly what you're aiming for? I don't want to miss anything.
you mean during commissioner comments?
When we are going to approve the document, there'll have to be an amendment for what you're asking. So I'd like you to, if you can formulate something that includes everything you're thinking of, just like you said it, so that nothing is left out. And
I
no
read
one is-
it.
And no one is confused.
Okay, if you're confused, we'll do it later. Is that what you're saying? When would you like to do this?
When it's time to approve the
Okay.
document, and
Okay.
you'll add for an amendment, and then we'll see how that goes. Am I
Okay.
doing this legally, David?
No, that's fine. When you get to the recommendation is to recommend the approval of the RFP 2022 document, and to recommend to the city council that they approve the document to be released May 4th, including the amendment that social isolation and loneliness
Right.
will be called out as a city funding priority.
Thank you.
Okay.
Yes.
Anything else, Vice Chair?
I just want to thank Commissioner Davis for calling out the word seniors and saying it should be older adults. Thank you.
I think everyone spoke. It's just me. So I just have a couple of comments. I like Commissioner Byers' idea. She's approaching this holistically with prevention dollars, and I'm always in agreement with that, whether it be housing, food, or whatever. With Commissioner Borelli, with the additional food services that we're looking for with the expansion of food services, I too have a lot of questions as to where the dollars will come, or actually how the providers will work this. And that to me is a very important thing. How are they going to handle this part, and to what degree will we do it? I understand it's needed. It's just something new, and we're going to have to see how it goes. For the folks that are relatively new, no one's brand new here. The bidders meeting is one of the meetings that I learned the most at. So if you have the opportunity to go, I truly recommend it. And I think that is all I have. Yes. So at this point, David, we're going to make a motion to approve this with the amendment that Barbara has. Commissioner Davis?
I was just gonna make your motion. I move that we accept the report as amended by Commissioner Meltzer to move forward.
And David, you have that amendment complete, yes?
Correct, yes.
Okay, is there a second?
Second.
Okay, so move by Commissioner Davis, second by Commissioner Darvish. Can we please get Commissioner Borelli?
Just a question on the motion. Are we actually removing the line as communities grow older, they can become increasingly isolated, leading to depression, other health and mental health conditions? Are we removing that from the Aging in Place, Aging Community Initiative and adding social isolation to our city funding priorities box? Or are we leaving that in that place and adding the social isolation bullet to the city funding priorities box?
My
Okay.
understanding is that we are leaving that language in the aging in place section, and we are adding social isolation and loneliness
Right.
to the city funding priorities. Is
And
that correct?
Yes.
that's the way that's the way I understood the motion when I made it. So
Right.
I agree with Mr. Borelli, or Commissioner Borelli, pardon.
Then I'll third the motion for wherever we're at.
Commissioner Darvish, now that you have a full understanding and explanation, did you still second it?
Yes, and that was my understanding too. Yes.
Great. Can we get a roll call, please?
Yes, we can. Commissioner Borelli,
Aye.
Commissioner Byers,
Aye.
Commissioner Darvish, or
Aye.
sorry. Yes.
Oh, yeah.
Commissioner Davis
Aye.
and Commissioner Freiberg is absent. Vice Chair Meltzer
Yes.
and Chair Palmieri.
Yes, thank you very much. It passes.
Thank
Thank
you.
you so much for your help. Next, David, thank you very much.
Thank you.
Next, 4B, preparation for the 2022 to 2025 RFP funding process, and this is going to be handed over to Leslie.
Yes. Hi, good evening, everybody. Excuse me. This portion of the meeting is going to be dedicated to walking the commissioners through a sample budget so that you can get familiar with what the budgets will be looking like as you start to review the applications when they come in. So I'm going to go ahead and share my screen. Maybe. Can you all see my screen? You see the
I
budget?
can now, yes, I can now.
Okay,
Yes.
all right. This is a little different from the program we work on during the day, which is Microsoft Teams, but same idea. So what you have before you and what you have in your packet is, just as I said, a sample budget. The budgets are typically 2 pages. The first page of the budget is always personnel focused. And so in this particular example, we have 4 positions for the Exemplary Social Services Agency. Excuse me. And I'm going to walk you through these a little bit line by line. There's only 4 positions, but they're all structured a little differently, and you will see a whole host of ways in which applicants structure this. So we're going to go through them each as an example. In the first line, you have the executive director position, and note the description underneath the title in the far left column. It says executive director. This is a full-time agency position paying $120,000 per year. The executive director spends 10% of her time on this project. So this is just simple math going across the row here. 10% of the project, 10% of time on the project with a monthly salary of $10,000 comes out to a total grant share of $12,000. Total grant share is what the agency or program is asking us to cover. We are that column. The column to the right of that, the non-grant share, are all their other funding sources that are going to cover the remainder of the position. So the total cost of that position is 120,000. We see that on the right side, but we're only being asked to cover that 10%, the 12,000. So that's pretty straightforward mathematical calculations. When you look at the second position listed, a bus driver, you'll note here that this is a part-time position amounting to 15 hours per week, which is 37% of a 40-hour-a-week position. The driver will not be needed during the first 5 months, and the position is fully funded by the grant. So the monthly salary for this position is $3,000. We already learned that their 37% of their time is on this grant. They're only going to be working on the grant for 7 months of the 12-month period. First 5 months, this position is not needed. We're the sole funder. There's no other non-grant source. So we would expect that this person's 37% will be 100% to West Hollywood, and the total amount is $7,770. I'm going to continue with the next two, and then if you have questions, we can talk about them. The third position is an accountant, and this is fully funded by the agency. In other words, they're not asking us for any money for this position, but we like to see that this is a win for the city, right? Somebody who's going to be doing work on the grant, but they're not asking for our money. They just want to show the staff that's working on the program and that it is being covered 100% by another source. So the math again, $5,600 for the monthly salary, 25% of their time on the grant. They're going to be on the grant for the full 12-month period. They're not asking us for anything. A whole separate funding source is covering this position. And then the fourth position listed is a program director. And it says that this position will not be filled until the second month. So we already know it won't be a full 12 months on the grant. It'll only be 11. And it is funded by the grant. So this is the opposite of the line above where we're paying for all of this. There's no other source coming in to cover any portion of the grant, of the position rather. It's $5,600 a month at 100% times the 11 months equals the $61,600. So you see the total the total salaries there. And then the second section of this first page is relates to what Stephen was asking, Commissioner Davis was asking a little bit earlier in the meeting in terms of fringe benefits and other cost calculations. And every agency receives, and we encourage them to refer to a accounting handbook that lays out some specifics about how they can charge and what we can cover, what the city can cover. So these cost calculations that you see right here are standard across the board. And you can see the total benefits added to the total salary, and you get this bottom line of personnel costs. And so in this example, the city, scrolling back up to the total grant share right here, the city is more or less being asked to cover roughly 30% of the program costs for personnel. Unless there's questions, I'll go on to page 2.
Can I just see if there are questions, Leslie?
Sure.
I'm going to have to scroll down, so please just give me a second. Commissioner Davis, I saw your hand go up quickly. Do you have a question?
I just had a question about the very first guy, the executive director. Her salary starts off with $120,000 per year, and then the monthly salary is $10,000. Oh, I see where my error is. Never mind. I'm trying to put percents and numbers. Never mind. Please forgive me. My question is dumb.
I
Thank
like
you,
those
Commissioner
kinds of
Davis.
questions.
Commissioner Byers, do you have any questions or comments thus far?
No, I don't.
Commissioner Borelli?
I'll just say, especially for the new folks, like this is where the staff really is amazing, that they track these, that they track them on a quarterly basis. This again, I write a lot of grants. I have to do reports. Some of them are challenging. This one every quarter is definitely time spent, and I think our social service providers thus far and our staff really get their due for making this all work. So thank you for that, and I always appreciate Commissioner Davis's fine detail on these as we walk through the process.
Thanks, Commissioner Borelli. Commissioner Darvish? Any questions or comments?
Yeah, great job, Leslie, in going through the list. I did forget to ask a question my last a few minutes ago about David about labor and increase in cost of labor. I guess that's something we'll have to see on RFPs proposals, what they proposed. We've seen, as you all know, we've seen increase in labor hours, dollars, labor pay. And I imagine that would have an effect on this budget. I was just wondering what David and Leslie are thinking about that, or just something I guess we have to worry about when proposals come through.
There is an oops.
Go ahead,
excuse me
David.
for that. There
That's
is
right.
an expectation that the minimum wage will not be below the city's approved rate of $19.35 an hour. So we could see, we went through all of the current contracts as council has been looking at minimum wage and living wage to see, what the impact might be on our currently contracted agencies when we require this. And, thankfully, to the credit of our organizations, it's minimal. There are very few positions currently that pay under the 1935 approved minimum. So yes, we've looked at the impact. You can see, I think these are all factors you've mentioned tonight that could, increase the total dollar amount that's being requested. As commissioners who participated in this process before, we're going into this process with approximately 5.2 million allocated. We frequently see, at least 7.5 to 8 million in proposals. So we are prepared to potentially see an increase in that with the increased wages.
Is that it, Commissioner Darvish?
Yes, that's it. Thank you.
Vice Chair Meltzer, any questions or comments?
No, just thank you so much for doing this. It is so important. Thank you.
All right, I just want to thank Leslie for making something very confusing a little bit simpler for us tonight. I think it's always appreciated.
Thank you. With your permission, I'll continue on to page 2.
Please.
Okay, so page 2, there's 2 sections in page 2. We saw on page 1, personnel costs, and page 2 is divvied up into 2 separate sections. One is facilities costs and the other is program costs. So if we look here at the first half of page 2, you will see that the facilities costs on the left column cover things like rent, utilities, phone, equipment, maintenance, repair. There are other things we'll see sometimes. We'll see security. We might see things like janitorial services, things like that. Again, for purposes of just going through a sample, we kept this to 4 different facilities costs. And again, these are simple mathematical calculations. In this first line, we see that we're looking at covering a portion of rent. The rent is 2,000 square footage is 2,000 for this agency. The cost Per square footage is $1.35. The program occupies 300 square feet of the full 2,000. So here we're looking at a grant share amount. When you do that mathematical calculation, our percentage would be $4,860. The non-grant share is just over 27,000, and we can see that the total rent for this program is 32,400. With utilities, it says that 15% of the projected total annual cost charged to the grant. Again, that's a mathematical calculation with us covering $750 of the total of 5,000. A lot of times, you know, what agencies will do, I'm sure you've all seen this, is they will do the math compared to, in some cases it's, you know, for rented square footage, sometimes it's FTE, full-time employees. And so there's a constant kind of, you know, way in which these numbers get backed out. And one thing you should know is that the city will only pay for will only cover the portion of the grant that will only pay for the portion of the, David, help me phrase this. It's not coming out. The city will only cover the portion of the grant for the service, percentage of service we are getting. That took a minute to think about. But if we're covering 30% of the grant, we expect to get at least 30% service, right? If we're covering 30% of the grant or we're being asked to cover 30% of the grant, we're only getting 15% of the service, we would not approve the budget. However, this may not surprise you that the opposite would be something we would certainly consider, which is we get more service than we pay for. And you saw that in page 1, where we have, you know, full positions that are covered, that will work on our grant, but that are covered by other sources. So moving on to the third line of the facilities cost, this is telephone. It's projected at $75 a month. And we are being asked to cover 100% of it in this sample. And that would be maybe we, in a situation, let's say we're providing outreach services to unhoused community members, and the outreach workers need cell phones to do that work. They're 100% on this grant, and we're going to pay 100% of their cell phone. So we will look at the staffing and be sure that it makes sense that we cover 100% of any line on the second page. And that would require that, you know, that staff is dedicated to the West Hollywood portion of the program. And then lastly, in this section, we have equipment maintenance and repair. This is an example where we're not being asked to cover anything. The equipment maintenance repair total is $500, and it's being covered by another source. So that's that section. And then you get down to the second section, and that this is program costs. So the first section on this page is about the facility, the building, the equipment, and here program costs are really things that pertain more to what's involved in actually providing the service. So in this first line, we see vehicle rental at $300 a month. Again, you know, our programs that deliver food, home delivered meals, or our services to unhoused community members, both of those types of services would likely require a vehicle to make deliveries or for staff to take people to various appointments or commitments. In this line, just scroll up so we can be reminded, the grant share is $3,600. We're being, as I said, asked to cover it all, and we would check to be sure that it makes sense that we cover it all. In vehicle insurance, here again, we're being asked to cover the insurance. That would make sense if the vehicle is 100% to our program, that we would also cover the insurance on it. The third line, audit, charged 1/3 to the grant based on proportion of the grant. And we saw that we're covering 1/3. Remember when we looked at the front page of for personnel, we're covering roughly 1/3 of this program in personnel. It makes sense that we would be asked to cover roughly 1/3 of the audit. Printing and postage for a program brochure. Again, if it's a program that's 100% West Hollywood, it makes sense that we cover that. And same with postage and insurance. It looks here like in the sample that's being covered by other sources. We know that there will be postage and insurance costs to our program. We appreciate when we see that other sources are covering that. Urgent fund is a unique line. You will not see this on any application, or let me put it this way, you should not see it on any application where the program does not provide case management. So urgent fund is a line that we have afforded agencies who provide case management where the cost of whatever that client might need to be case managed isn't covered by anything else on the budget. I remember this line came into existence when we had this unusual, this was years ago, but we had this sort of unusual situation where there was a heat wave in the city. That part's not the unusual part. We had a community member who had a property owner who agreed to buy the individual a window air conditioning unit, but stopped at having anyone install it. And that was this like quirky expense unique to this situation. And the agency needed to cover it so that the person could have the air conditioning, and they didn't know where to take the money from. And we started to see examples like this over time. Somebody who became frail in their building and was unable to walk the distance to get their mail. And so an agency asked to cover a door mail slot so that the postal carrier could actually drop the mail through the door. These are just kind of these, unusual circumstances where we like to give the agencies who provide case management some discretionary money really for those unique situations. So in this particular example, there's $2,500 in urgent fund. We would not expect to see that. Any of that would really be covered in a non-grant share. That's a unique West Hollywood thing. The last line is indirect costs. We allow a maximum of 10%. So agencies can charge a total of 10% of their grant amount to this line. And indirect costs are kind of like the overarching costs that agencies incur that don't fall into direct personnel costs. Like we're not funding a full position or a significant portion of a position, but we might be funding, some bookkeepers who don't spend a lot of time on this grant, but they do a little bit, here and there. And so that kind of, falls under this sort of 10% allowance where just sort of everything else that it costs to run a program can be considered an indirect cost that kind of fissures out to all aspects of running a program. And what we require here is, as I said, we allow a maximum of 10%. In this example, this only 7% is being charged. And what we require is what we want to hear from the agency, what is included in their indirect costs. And we need to approve what they are stating is included, because we don't want to see anything that we're already covering for in a specific line. Like if they were to put equipment maintenance and repair, as part of what's covered in an indirect cost. Well, we already see that here on the budget, so we wouldn't approve an indirect cost definition that includes something that's already covered in the budget. So here again, the totals now in this very bottom line are the 2 pages combined. And you see now that we're covering 125,290 out of the 376,522 for the total cost of the program. So I am happy to answer any questions you have on either page 1 or page 2 of the budget.
Okay, let me go through the commissioners, please. Commissioner Darvish, do you have any questions for this particular part?
No question.
Thank you. Vice Chair Meltzer,
No, thank you.
thank you. Commissioner Davis, thank you.
So thank you.
Commissioner Borelli, thank you. Commissioner Byers,
No, thank you, Chair.
thank you. Leslie, I just have one, it's a small question, but you spoke about urgent funds and, you know, I understand what they are, but maybe you could just very quickly say, how does a provider access urgent funds? What is the process?
They have it. It's part, you know, if they apply for it and we approve it, then the funds are given to them to use in, as I said, sort of whatever way they deem necessary. We have brought to the commission, you know, over the years, a mid-year or maybe a year-end report on how urgent funds are used. We'll get a list of some examples from the agencies who receive them.
Great. Thanks. It's always good refreshing.
In addition, Chair Palmieri, once we execute the contract, we pay, usually because there's a lot of paperwork involved with execution. So the first payment that the agencies receive is usually for the first 2 months, so October, November, and the total of emergency funds that they've been approved for. So if it's JFS and they've been approved for 20,000 in urgent funds, they'll get that up front.
Upfront. Great. Thank you. Leslie, anything further to go?
Nothing from me. As applications come in and you start to review and look at the budgets, hopefully this will give you a good idea of what to look for, and we're always available to answer questions as that review takes place.
Leslie, thank you so much. It made it very easy to read and understand.
My pleasure.
Now, can I have my screen back?
Yes. Sorry. Happy to stop sharing.
Thank you very much.
Sure.
Okay. Next, I have to say this out loud. 5, excluded consent. There is nothing on excluded consent. Number 6 is items from staff. Who wants to begin? Maybe David, and then we'll go from there.
I'll begin. I wanted to first respond to Commissioner Byers, who at the last commission meeting asked about transit services and budgets. We are bringing to the commission, we just took to the Transportation Commission, we'll bring to the Human Services Commission a recommendation of a transition of programs, specifically Dial-A-Ride, to a proposed microtransit program. And I'm bringing this up because it'll also tie in funding, current funding amounts for the various programs and what this transition would look like as far as funding. I'm actually going to see if our transit staff, Francisco and Doug, can bring it to the commission at the May 9th meeting. So I just want to be sure that you knew we were responding to that. And then I just wanted to give the announcement to all of the commission that May 9th meeting will be in person. So we will be in person at Plummer Park, rooms 5 and 6. So with that, also wanted to mention that this will be the final meeting that is live streamed to YouTube. We do not have that capacity at Plummer Park. So it will be a little bit like going back to old school. We will have hard copy copies of the packet. We'll have that available for the public who will be there in person. There is fairly limited technology right now in Plummer Park rooms 5 and 6, but that is the plan. All of the commissions are scheduled to come back online in person in the month of May. And then we are booking, and so we're looking at the remainder of this RFP process to be in person. We have booked spaces. We'll be in the council chambers for the 3 meetings in July. Get ready for that for the month of July. We'll be in the council chambers, and then for the other meetings, we'll most likely be in Plummer's room 5 and 6. I just wanted to give that heads up. It doesn't seem like much, but it'll be a bit of a transition. So, and of course, you can always reach out to staff if you have questions about that process. So, and with that, I think Leslie and or Derek may have items. If Derek's still on here.
Leslie, or who wants to go first? Derek?
Sure. I just have something quick. Is that Commissioner Chair Palminieri asked about mental health services and their substance abuse programming. So the Addiction Recovery Services program is now called Substance Use Recovery Services, and they now have a new program manager. His name is Alan Montes, and he will be starting on Monday. But for right now, Amy Kane is the contact for that program.
Great.
That's all I wanted to say. Thank you.
Thank you so much.
Which agency, Derek?
Sorry, the Los Angeles LGBT Center.
Thank you.
It would be great if we ever met them. Leslie, did you have something that you wanted to say also?
I just want to say that Older Adult Month is happening in May. And we have a whole calendar of events coming up. And our intern, Becca Lubin, put together a really nice calendar. It's going to the to the city council on Monday night. And the city council will then be presenting a commendation to the chair of the senior advisory board, Joy Newell. But we'll get that calendar out to you. It's in draft form for the council, and then we'll get it out to you so you can see the whole array of programs taking place in the month of May. Many of the programs are city programs or programs that the city is co-sponsoring with other agencies, and several of the programs are put on by the LA LGBT Center Senior Services Program and the West Hollywood Comprehensive Services Center's activities department. So just wanted to let you know, and you'll be getting that in your inboxes after the city council meeting. Thank you.
Thanks for the information, Leslie.
Sure.
David,
real quick, I apologize. The next meeting is Tuesday, May 10th. I misspoke and said the 9th. It's the 10th.
Well, you ruined my whole calendar now.
You fixed mine.
But David, while you're speaking, I would like you to explain to my colleagues about masks and social distancing.
So the requirement for indoor facilities is that city staff remain masked. There's not a requirement for the public. There's not a requirement for boards, commissions, and councils. If you've watched the recent council meetings, you'll see that they are not masked. And also the social distancing requirement has been is no longer in place. So we will have the setup very similar for the folks who've been there, similar to how it was before. I actually met with Joyce and Dee before this meeting, talking about a facilities request for 5 and 6. We strongly encourage for folks who want to wear masks. There's no discouraging that, and staff will be masked. So, and certainly, reach out if you have any other questions about the meetings and in regard to the public health directives.
Thank you. All right, I'm going to go around with the commissioners and see if you have anything that you might want to. Oh, I'm sorry. Do we have any more public comment? I didn't see anyone in the audience that's with their hand up. Hello?
Joyce, do we have any other public comment?
We don't have any other public comment, but let me just open it up. If anyone would like to speak under public comment right now, please raise your hand and I will unmute you. Does anybody want to speak for public comment? Okay, we don't have anyone for public comment and you can
Thank you
proceed.
very much. Thank you so much. Items from the commissioners, I'll go around. I'll start with Commissioner Byers this time.
Thank you, Chair Palmieri. Thanks staff for this great walkthrough of the RFP document. Leslie, just taking the time to go through the budget proposal, really appreciate that. Wanted to say happy Queer Women Lesbian Visibility Week. Looking forward to the Meet Us in the Park event this Saturday. Vice Chair Meltzer, when you spoke about social isolation and that everybody sort of feels this, I thought about that event immediately and the sense of camaraderie and community that gets built because West Hollywood puts on great social programming like that. And so just thank you for connecting the dots and reminding us that not just older adults feel that way, but everyone can feel that way. I really appreciate that. I wanted to uplift that event. I also wanted to say that I am currently battling COVID for the first time in 2 years. I caught it just this last week and it has not been easy. And so I am a little uneasy about the lack of mask requirements in an indoor setting because we're still very much going through this. And just know that I'm so excited to be back in person and I want to have those opportunities. And I just want us to be hyper aware that this is still very much going on in the community as well. So with that, wish everyone all the health always. And thanks for another great meeting tonight, y'all.
Thank you, Commissioner Byers, and I hope you feel well very, very soon. Commissioner Borelli?
Thank you, Mr. Chair. Yeah, I'll piggyback on Commissioner Byers. I have concerns about it as myself. I think since we're not televised and we're in Plummer Park, I request that we have some decent separation between us. I'll never shake a hand again. I will probably not hug people. I haven't been in my pod for a while. I probably feel a little bit like Commissioner Byers was like, oh my gosh, I came this far and now I don't want to get it. So even mild symptoms. So if there are considerations for this first meeting in particular at Plummer Park in terms of the spacing, I think we would all appreciate that going forward. I have a question that I really toyed with asking at the top of the meeting, but I didn't want to jump on the chair's flow. The land acknowledgement statement that was read at the beginning, did I miss, like the meeting I missed, was there a part of that land acknowledgement that I missed in terms of the direction from the city?
Do you want me to answer?
Whoever.
It was just given to me. There was no explanation. Maybe David has a clearer explanation for it. I was just told that it had to be read before the meeting started.
My understanding, it was a direction from council to the city clerk's office. It's been added to all of the boards and commissions agendas.
Okay. It's a little odd, and I know this is not this staff's purview. And when the city clerk chimed in, I almost said, "Hey, stick around," but I didn't want to waste your time because we agreed and acknowledged something that I have no information of. So I find that a little odd and weird that there's direction from our council with really no explanation from the council or the clerk's office. So if we can have some more information on that, I would really appreciate it. If that's historically accurate, and I'd love to know about it, and I'd feel much better about acknowledging the truth of that in this case. Otherwise, I'll just, because I didn't comment after Leslie's presentation, like those reports are really particular, and I once again applaud the city, the staff, the leadership, the 7 years of history. My sister in Huntington Beach with her catastrophic illness, they have nothing like we have here. They have nothing like we have here to help people. Very, very, very basic. So good for us as a city, and from my own role, just like thinking about the rent is covered, the portion of this is covered, like that is tremendous. The good work I continue to look forward to as we walk through this process. I'm glad to be here with you all.
Thank you, Commissioner Borelli. Commissioner Davis?
Just real quick, I'm very excited about going back into the real public realm. And I believe that while Zoom has worked, it's not really good democracy. And I just think that it's as good as it can get. So I'm looking forward to being back into the real world. I do know that my husband will not let me out the door without my mask. So I more than likely will be masked, but that eventually will also fade away. So I'm just very excited about seeing each and every one of you again. And that's it, actually. Thank you all very much. It was a very good meeting, by the way. Thank you.
Thank you, Commissioner Davis. Vice Chair Meltzer?
First, thank you to staff for going over all of that. I personally can never hear it too many times. Trust me, I can never hear it too many times. But I wanted to tell you that I was in New Orleans, which is why I missed our last meeting. My county commission sent me to the American Society on Aging conference. It was in New Orleans. It was 3.5 days, which is why that aging stuff is kind of top of mind for me right now. Always, but certainly right now. And there were a couple of workshops that they had over 300 workshops and all this, keynote speakers. But I went to a couple about ageism and how ageist our society is, and much of that is language. And I hate to be boring about that, but it's so true. And there are words that people are not using anymore, or really trying not to. Elderly is one, old is one, and senior is one. So it's just, I've had 3.5 days of that. So it was actually quite wonderful. And I'd like to bring some information to you as I do my reports. Thank you.
Thank you, Vice Chair Meltzer. I see Dee Saunders with her hand up. Is there something that you need to tell us?
Good evening, Chair. My apologies. I just wanted to piggyback off of Commissioner Byers. So this weekend, the Meet Me in the Park event, I will also be bringing back the Lesbian Speaker Series. This will be a panel discussion entitled "You Want Me to Call You What?" for Lesbian Queer Women Visibility Week. That takes place at 11 a.m. So it's going to be a wonderful conversation with some awesome panelists, 4 panelists and a moderator. If you all feel free, please come down, join the discussion. It's open to the public. We are hoping to have employers in the city come out in attendance to just help bring awareness and respect to our community members, gender non-conforming, gender non-binary, queer members in the workplace. So thank you. Thank you very much. Again, my apologies, but Commissioner Byers, you rang a bell of remembrance. Thank you.
Thank you, Dee. It sounds like an amazing event. Thank you for letting us all know. I apologize, Commissioner Darvish. Did I call on you yet? Because the boxes keep changing and I'm trying to go in order. So have you given your item yet, or items?
Yeah, you haven't called. I just wanted to thank again David and Leslie and the team for a great presentation and walking us through, most of the grids that for some of us were not familiar with. So great job in that, and the details that was provided in the packet. And I'm looking really forward to the process through the end of it. It'll be, I'm sure, a great learning experience. But to Commissioner Byers' point, I just traveled to Washington, D.C. I think I emailed you all, was worried that I couldn't make this meeting, but it was part of American Hospital Association annual meeting. So every healthcare executive and physicians and players in Washington, D.C., policymakers were at this meeting, but most 99% didn't have a mask on. And there's meeting rooms, large meeting rooms, small meeting rooms with 20 people, So I was a little uncomfortable. I had, mine on my neck and I would put it on. I just had my second booster just 2 weeks ago. That was painful, knocked me down for 3 days. But it's a personal choice that we all make. And the feel, I understand, all of us wanted to be over behind us. On the plane, obviously is not a requirement. Most people didn't have it on. I would question, even when we had it on, take it off and, drink a drink or have some food. So what kind of, effectiveness is that? I don't know. So it's very confusing. But, I guess on a personal level, I'm not going to take it off because it helped me not to catch a flu for 2 years now. So I definitely will put it on the plane. It's not just COVID, it's all this other stuff. And in meeting rooms, I'm learning more that I don't care what other people think. I want to protect myself, and it's a personal thing to me. But I'm sorry to hear that Commissioner Myers had caught COVID. I'm sure you're young and healthy, and you get through it. And this version of it now is a lot weaker from what we see in healthcare. So no hospitalization in most cases, and is easier. But Dr. Fauci was at this meeting. Andy Slavitt, I think, was the advisor, COVID task force advisor for President Biden. He was presenting at our meeting. But for me, it was amazing to watch Dr. Fauci in front of us, and nobody had a mask on. So, it's sort of, again, there's an era that I understand we need to put behind us and move forward and produce again. We can't, even in healthcare, we've been, at the leadership levels behind Zoom, and now we're trying to get out and meet face to face. There's nothing that will replace that. But a lot of priority was on extending the relief for telemedicine, for technology, because a lot was learned from that, the 2 years. We're asking for more funding, more help with the labor force. There's a huge shortage in healthcare, and federal government is feeding some, funds and grants into it so we can train nurses and other caregivers, including physicians, to be able to care for people. So it's just a lot of changes. But, again, overall, I'm proud of our city. I saw next door hotel in DC. There were tents for homeless people on TV. The same topics about, funding the police and issues that the council member had and the mayor had, and back and forth, just healthy conversations. But it was interesting to see the same agenda in DC and in our small city of West Hollywood. So we're on the right track. And again, we got great talents and our social services department, I believe, is one of the most effective ones in the country from what I hear and what I read. So great job. Thank you so much.
Thank you, Commissioner Darvish. I'd like to ask a few things or make a few comments. First of all, Commissioner Borelli, that was the first thing that came to mind with me when I was given that to read. And I think it would be fair to all of us to have a clear and concise explanation as to why we are reading that. I have no prejudice to it. I just want the information, and I agree with Commissioner Borelli. And maybe the city clerk can come and give us that. Maybe you can provide why it was put in or whatever information you have. But I would like it. David, did you want to say something?
No, I definitely will follow up. I'll try to get the information provided to the commission prior to the next meeting.
Fantastic. We're meeting in person, and I can't wait to see people. I enjoy seeing all of the public, and I especially miss my colleagues. I'm going to be wearing a mask, and I want to ask staff, and this is important for me, that you make sure that the doors are open and that there is air movement. And I know that there are 2 huge fans that are available in those rooms. This was a concern of mine even before COVID, and it was taken care of without question. So if we could just have the fans blowing out the door, I think I'd feel a little bit safer. It's certainly not going to prevent every case or whatever, but with 4,500 cases yesterday, it is a little nerve-wracking. I will wear a mask. It seems like all of my colleagues will, but I would like complete airflow through that room if possible. That would make it very, very comfortable for us. And another thing, and I know that this is a request that can be filled, but I know it's could take someone to do it. I, myself, and I believe Commissioner Davis, and I believe Commissioner Borelli will not be able to sit on a folding chair for that amount of time. And I need to have the kind of chair that we have, or that we had, I'm sorry, in the community room for us to sit on. I don't know if anyone else needs it. I absolutely need it. You know, I've just recently had surgery. Commissioner Borelli and Commissioner Davis have had surgery, and I think that we can be afforded those particular chairs. Do you see a problem with that, David?
I'll reach out to facilities. I think these are all good questions and reasonable requests. And I think we're all looking to, how we best do this transition. I think we all saw this transition coming, and now it seems like it's happening very quickly. But yes, that's absolutely a reasonable request. And I'll make sure, I guess the question for myself is, I don't know if they are available at Plummer, but we will do our best to have them available there.
Yeah, and also the fans, please make sure that we have them. We have had them on other occasion, like way before COVID. So I think that it's a fair question to have. Our next meeting is May 10th, correct?
Correct.
Mention again the date of the bidders meeting for the new folks.
The bidders conference.
Yeah.
Is scheduled for Wednesday, May 11th. And we've been working behind the scenes. We put in a request for it to be at the community room at the library, where we've had it previously. We haven't gotten that approved yet, but we put in that request for us. So we will get that.
Small and tight room, just to let everyone know that
Yes.
is small and tight room. So you may want to have your mask, or you may want to make sure you're standing in the back if you're a little bit afraid. Vice Chair Meltzer, was there something else?
I just heard, because I was asking about the community room, that the staff, the Parks and Rec staff, uses it because their offices are not open. So, because we wanted to do an event there.
Yes. Well, we'll wait and see if we get that final determination from them. But yes, you are correct.
So you'll let us know as soon as you get that information, David?
Yes, the other option, because we did ask for 5 and 6 first because of its spaciousness, the other option is maybe we look at Fiesta Hall or one of the other, large spaces.
David, I'd like to make one more request, and I know that it's possible, and we have had it on occasion. We will be in Plummer Park at 6 o'clock, and it will soon get dark. Will we have some type of security there?
I can put in a request, yes.
Please do. As you know, I've had some difficulty with some public commenters that have even called me at my home. And I want to make sure that in the dark, I'm not having to worry about any of that.
Absolutely.
Okay.
Put in the request.
Thanks so much. I appreciate it. And I appreciate everything that everyone did tonight. Are there any adjournment motions? No? Anyone?
Motion to adjourn.
No, okay. Who seconds?
Second.
Do we need to take a roll call for this? The adjournment?
No.
Let me ask you a question, because we needed to take a roll call when someone wanted it adjourned in someone's name. Because this is a new process for me right now.
Correct, but you do not need to do a roll call for the actual adjournment.
For either.
Correct.
Okay. All right.
I believe the chair can just adjourn the meeting, is my understanding.
All right, well, I'm adjourning the meeting. See you guys later.
Can't wait for these to be in person.
Please feel well.
Yeah.
See you guys at Plummer Park.